What needs to happen for the CDC to decide we're going ahead with vaccine production?
Well, that's a decision that's broader than CDC. It's a policy decision made involving the National Institutes of Health, the FDA, CDC, and then advisory committees to the department. It's a big decision. Do we ramp up production for this new infection? Is it something we'll expect to see in our communities next year? And that takes pulling in a lot of expert advice.
What needs to change? What data don't you know now that's important?
Well, I think we have to see how this progresses in our communities. What happens? Do we see this virus ramp up and cause much more in the way of severe disease? Right now in the United States, we have 6 confirmed hospitalizations. If we're seeing quite severe disease and disease in populations that traditionally are not impacted by seasonal flu, that would be much more concerning.
Do you have a sense of how long it will be before you'll be able to make that decision?
You know, that's something that with a new infection, a new emerging infection, you know in retrospect. We plot the cases and we look and see how that's going, but at this point, we can't say.
From the moment you make the decision, we're going ahead, how long will it take to actually have the vaccine made?
Well, we anticipate that when we decide to manufacture vaccine, we will have a large quantity of vaccine by the fall for next year's flu season, and that would be the goal there.
And how many months does it take to make that?
Well, you know, at this point, we're moving forward as if we're going to produce a vaccine, and so the decision would be, do we stop? So what we're doing is we're growing up the virus. We're doing all of those things so that if we decide to make a vaccine, we haven't lost any time. We're doing all of those steps, and that's the smart way to go.
So the fall of September, that would be 4 months from now, about? 4 or 5 months?
Yeah, that's right.
So how many months would you say?
You know, I'm not a vaccine producer or a specialist in vaccines, so you know, I'd rather not give you a number on that.
Do you have any sense of how effective a vaccine would be?
Well, you know, vaccines vary in their effectiveness. As many people know, some years we hit it right on for flu season, and the vaccine is very protective. Other years we don't, and the reason for that is primarily changes that occur in the flu virus over time. As the virus goes from person to person, it changes ever so slightly. And so at some point you have to say, this is the strain we're going to use for the vaccine. And then your hope is that the virus doesn't change too much so that that vaccine will be very effective.
Logistically, are we prepared to administer the vaccine? And how many people would you think would get the vaccine in, say, the first wave of giving it?
You know, one of the things that we've been working on and exercising is how do you rapidly administer either vaccines, or how do you rapidly distribute drugs if they're needed. And so I think we have the infrastructure in order to be able to administer vaccine. And so it'll be a matter of looking at, in the end, how many doses can we produce, who are the individuals who are at greatest risk, and then the decision, do we move forward with giving that vaccine?
What lessons have we learned from the 1976 swine flu outbreak?
I think we've learned a number of things from the 1976 swine flu outbreak. One is that sometimes microbes are smarter than we are, and what we think may happen doesn't happen. Another thing we've learned is the importance of public engagement around these type of critical decisions. It's going to be important that we engage the public in the decision around who do we vaccinate and do we vaccinate? And that's as well as engaging the experts in that decision.
And what about the specter of Guillain-Barre syndrome? How does that go into your thinking?
Well, with any vaccine or with any treatment, you have to always weigh in your mind, is there some potential untoward consequence? And is that untoward consequence potentially worse than what you're trying to prevent? And we always try and balance that in our decisions.
Big question everybody wants to know. Why is the virus seemingly so much more deadly in Mexico than in the United States? Or is it just that we don't have enough information?
You know, that is the critical question. We want to understand, why are we seeing a different picture in Mexico than we're seeing in the United States? And we have people on the ground. The global community is looking at Mexico. We're there as part of a tri-national team to answer that question.
Why shouldn't doctors prescribe Tamiflu just in case to their patients?
You know, when you look at a drug like oseltamivir or other things, I think we need to think about them in terms of a scarce national resource. And we want to make sure that they are used for those individuals who need them most. And so, if everyone in America were to purchase an antiviral, I don't think we'd have it for people who truly need it. There's also untoward consequences from using antibiotics and antivirals inappropriately. You can develop resistance in your community that leaves you far worse than you were before.
And last question is, how effective is Tamiflu? If you take it within 24 hours, will it prevent you from getting flu entirely, or how effective is Tamiflu?
We have experience in the use of antivirals from seasonal flu. And in that picture, we know that earlier administration is better than later. Earlier administration can shorten your symptoms. We'll be looking at that here with a new strain of virus to ensure that that's still the case.
But is it like 70% effective? Is it 90? Katie Couric actually asked me, he said, well, if it's so effective, why do we even have to worry at all?
Right. At this point in time, we can't say how effective it will be. We can tell you that the virus isn't resistant, but we can't tell you what happens when you take that virus, that drug, and put it in a person.
And then the last thing is, I'm going to just give you I didn't know even that I was able to be plugged in, and I did get plugged into my local Department of Health, and they gave me an advisory that actually changed the way I did something. They told me to do this instead of that. What would you say to doctors out there who are trying to figure out what to do? I mean,
it's so important that doctors know the information that's coming out of their local public health department, because that will be attuned to what's going on in your community. We provide national guidance. They provide guidance that you can use where you live.
We're going ahead and finishing the flu vaccine for this season, right? Will there be enough resources to both finish this season's flu, making flu for the next fall, and also ramp up for the H1N1?
We fully expect, with our existing flu vaccine manufacturing capability, to be able to make vaccine for next season and produce vaccine if we decide to do so for this new strain.